Thanks for sticking around for this. It's getting late in the day. We have just a couple more things to talk about. And in most sessions, and people that come are always interested to find out about other types of therapies and other things we can offer mesothelioma patients, but also their families. And obviously when somebody, particularly a lot of people who have extended families, go through something like this, the family gets involved as well, and they're involved as much as the patient is. So they don't get treatment per se with chemotherapy or surgery and else like that, but they go through it with their loved one. And so one of the issues is how do we help treat them and support them and through this whole battle with mesothelioma. So Lien Hua-Feng is our nurse practitioner who basically helps take care of all our mesothelioma issues. She does clinical trials. She runs the clinical trials for me and takes care of all patient calls, problems, and whatnot. And she also happens to be running a caregiver support group, which has been really successful. So I asked to see if she can give us some insight into caregiver support and issues that we might learn from. So Lien, take it away.
Thank you, Dr. Cameron, for the introduction. So I know this is getting the final hour of the symposium, and the next 15 minutes, I would like to highlight some of the cancer statistics. We got this, yeah. As well as the caregivers and their roles and responsibilities, the negative impacts that they encounter, as well as some of the some interventions that have been found in the literature for the general support groups for cancer in general, specifically for the benefits of the mesothelioma caregiver support group will be discussed. So just briefly on the cancer statistics here, there are more than 15.5 million Americans living with cancer in the US as of January 1st, 2016. And there are over 1.6 million new cancer diagnoses are expected in 2017. There's about 600, a little bit more than 600,000 Americans are expected to die from cancer in 2017. That's an average of about 1,650 people per day. One in every 4 deaths is actually a result of cancer, putting cancer the second most common cause of death in the United States. There are approximately 4.6 million people who are caring for someone with cancer at home in the States. And many of these patients they will be debilitated by the actual cancer disease treatment, as well as a combination of cancer and the comorbidities. So a lot of times, they always need regular assistance by the caregivers. And on average, there are about 3,000 cases of mesothelioma each year in the US, but when compared to other cancers like breast, colon, prostate, and lung cancer, mesothelioma is very rare, making up only about 0.18% of all cancers. And since mesothelioma falls into a group of rare cancers, and according to the American Cancer Society, there are challenges that patients and their caregivers encounter with having a rare cancer like mesothelioma. And some of the challenges they encounter includes healthcare providers in general have limited knowledge on mesothelioma, and so it's a very difficult diagnose it's difficult to diagnose, as Dr. Fontaine discussed this morning. A lot of patients present with shortness of breath, pleural effusion. They oftentimes go through multiple thoracentesis until they get a pleural biopsy. That's when they found out they have mesothelioma. So a lot of times patients and their caregivers make numerous doctor's visits. A lot of times they get misdiagnosed and delays in diagnosis, as well as treatment therapies. Rare cancers have few clinical trials with limited high-volume cancer centers available for them. And talking about caregiver support group availabilities is very limited locally. A lot of our patients live, in a rural area. They don't have access to big centers like, UCLA here. So their support group is actually very limited, and other resources are extremely limited fragmented and discontinuous. So let's talk about who the caregivers are and if they're ready for their roles. According to Bloom and Sherman in 2010, as well as Lee, Mack, and Loken in 2013. The caregivers can include the spouse, the partner. The traditional definition of nuclear medicine involves the parents, children, relatives, neighbors, as well as extended families such as grandparents, aunts, uncles, cousins, and their friends. And according to the American Cancer Society, the rates of mesothelioma is actually 4 times higher in men than in women. So that kind of implies that there are more female caregivers than their male caregivers for mesothelioma. And according to a literature review conducted by Lee and the colleague, they found that female spousal caregivers perceived higher level of negative experience in caregiving, such as lower mental health, lower physical health, as well as poor health-related quality of life, lower life satisfaction, and a decrease in marital satisfaction than the male spouse caregivers. And also with advances in healthcare, which extend longevity, that can and increasing the number of people living with chronic diseases and cancer, that so often living longer meant suffering longer and lengthening the caregiver's stress and burden as well. So these caregivers, a lot of times, they're not well prepared for this crucial and demanding role to take on to care for their loved ones affected with cancer, such as mesothelioma. So they often felt alone in their decisions as well as their caregiver journey. And this lack of preparation can worsen their anxieties that they already feel about a loved one's health. And I'm just going to briefly describe their roles and responsibilities. A lot of times, the caregivers already having a full-time job with their immediate family members, and they have a grandparent or their own parent having cancer, and they have to take on this extraordinary uncompensated care, causing more caregiver burden, which is very demanding physically, again, psychologically, emotionally, socially, and financially, and that results in neglecting their own needs. And as we know, the caregivers often provide quite a lot of care on a daily basis, especially their activity of daily livings like meals, transportations, medical care such as wound care, medication management, social support, including companionships, communication with friends and families, and encouragement, and being an advocate for with the caregiver, with the providers as well as the insurers. And these roles and responsibilities will actually consume more time, energy, as well as emotional resources from the caregivers if their loved one's illnesses actually progresses. And based on the literature, I found that there are quite a few negative impacts being a caregiver overall. It was found that it can be actually a full-time job, an averaging 8.3 hours per day for approximately 14 months, and that can go up to 66 hours per week during the patient's last year of life. And a lot of times the caregivers abandon their own leisure, religious, social activities just to take care of the loved ones having affected with cancer, and that can actually increase marital and family stress, which has a negative health consequences and instability of the family. It's also considered it's considered a vulnerable, high-risk job and population. It's empirically linked to a diminished quality of life, depression, impaired immunity, hypertension, heart disease, and early death. So a lot of times, many caregivers have to quit a paying job or take extended leave just to take care of the loved ones, which can actually worsen the financial impact of a cancer diagnosis. Again, other negative impacts for the caregivers include lifestyle disruption. Highlight social isolation is another one. And oftentimes they ignore and hide their feelings and needs, so causing a lot of psychological burden, which is actually found to be greater and actually greater for family caregivers than for the patient, especially as the disease progresses. Again, greater psychological burden for female than the male caregivers, and it's more stressful if the caregivers feel that they're not well prepared for the new roles, and their sense of low self-esteem and self-efficacy is actually heightened by the perceived burden. So I just finished talking about the negative impacts. From the literature review, there was actually, I didn't find anything on mesothelioma caregiver support group at all in literature. So a lot of my presentations actually involved are just findings from overall general cancer support groups. For the caregivers, if we can provide some sort of support that has positive outcomes for the family caregivers as well as patient alike, and some of the small interventions could be just education, skills training, and therapeutic counseling for these caregivers. They found there's actually positive effect on how caregivers perceive their burden, the quality of life, coping skills, and knowledge, which lowers the caregiver's levels of depression and distress. And patients actually experience less symptoms and better physical and mental health as well. And this is based on a meta-analysis of caregiver interventions. So again, an article I found by Owen and his colleagues in 2007 found that the prevalence of support group use is actually higher among cancer survivors versus other chronic disease. So there's approximately 24% cancer survivors use support group than other diseases of only just 15%. And 1 in 4 cancer survivors actually use support groups. The predictors of support group use is actually higher in female population who have higher education and who often use complementary alternative medicine, and they have depression and anxiety as well. So they tend to use a support group a little bit more. And perceiving support groups to be beneficial, participants found that the authors found that it varies from 35% to 96% of participants finding if it's beneficial or not. And a very interesting fact I found was that the percentage of participants reporting that their doctors recommending them to a support group was quite low. So it's only 10% that healthcare professionals are recommending them to a support group. So the benefits of having a support group can include, I'm going to go ahead and discuss a few things here. It can actually strengthen the caregiver's sense of control over their lives as well as provide greater peace of mind. And this happens when family caregivers know that they can get assistance when they need it, such as getting a medication questions answered or knowing how to deal with an emergency. So having a support group where they can contact and get that information and know how to deal with that is very beneficial. One of the other one is increasing hope. And I'm saying this is based on some of the articles I found as well as my own experience as a facilitator in a support group. A lot of our mesothelioma members, their caregivers, when they join the group, a lot of them are newly diagnosed, and when they have a group member in our support group who have their loved ones who are 5 or 6 years out, living and surviving this long, they find that it's very hopeful for them to have somebody that's been going through all of this for the past 5-6 years, and they can ask questions and share stories and learn ways to overcome during the caregiver burden experience. So there's a lot of hope for them. It actually also decreases psychosocial morbidity, offers proactive assistance, including anticipating issues, and I myself as a nurse practitioner monitor their loved ones as well as can intervene. I can intervene early if needed, depending on what kind of stories and questions they have. I can offer that kind of assistance and intervene early as needed. We can offer reactive assistance where I can clarify doctor's instructions. A lot of times, we see them in the clinic. Dr. Cameron can talk a lot about all these medical jargons and treatment therapies, but a lot of times they do not remember everything that Dr. Cameron mentioned. So a lot of times they, ask that questions during a support group or outside of support groups, so I can help answer, clarify stuff for them. Managing medication is another reactive assistance that can be offered during support group, and all of these components can actually avoid patients going through the emergency room. Just some more benefits of having a support group. Can help identify resources that the caregivers cannot identify on their own. And a lot of time we can provide courage, comfort, and reassurance that they're not alone, and that offers a sense of relief for them. So there's a lot of resources you can find online as well, but I just wanted to highlight this slide. There's more resources online, so patients and the loved ones can go through these sites for support groups. I'm going to briefly highlight the Pacific Mesothelioma Caregiver Support Group that I help facilitate, as well as Claire, Christina, and Sonia. We have this once a month meeting. It's every third Wednesday of the month from 7 to 8 p.m. Pacific Standard Time. It's actually a free online conference call where caregivers can call in from home, from using a phone, or just using the link online, where we email them a link and they can access online. We have one of our members who work and travel for business, and he actually called in from Bangladesh. So technically, it just shows that you can call from anywhere, just a phone call away. Various topics were discussed during the support groups. It ranges from pain management, chemo side effects, to complementary alternative medicines, ways to overcome certain side effects or hurdles. We offer ways to cope with stress, psychological burdens, as well as patients get to share their stories and just ask questions among the caregiver members. So it's quite informal, so it's a free open hour, they can ask anything. And I just seek testimonies from one of our support group member, and one of our member say the benefits of being part of a support group. She said that communicating with others who are going through the same experiences we are, finding out more information on different treatment methods that other patients are getting and how they're working for them. Also having things explained in a more personal atmosphere. Sometimes we don't understand everything the doctor is saying and too embarrassed to have him repeat it. Another member said that the open forum is comfortable for listening, with time to make and give suggestions on things that might help our loved ones cope and help the caregiver cope. My personal experience with the group helped me to feel less isolated. I'm a problem solver, and it was nice to know that what I was facing or feeling overwhelmed about or questioning was also being felt by the others. And overall, in conclusion, the PMC's Mesothelioma Caregiver Support Group is a great way for caregivers to come together and support each other monthly with any topics or questions from members. And so far, based on my experiences of facilitating this group, as well as the literature review, I found that having a support group is very beneficial for our members overall. And so if you're affected with any type of cancer or have a loved one who are affected with cancer, such as mesothelioma, please look into resources locally and online, and maybe possibly join a support group that can help you cope with this caregiver journey. And for healthcare professionals who are taking care of cancer patients, it may be crucial for you to offer the patient as well as the caregivers resources and support groups to help them cope with the stress and the burden of being a caregiver. Thank you. That's my reference. We'll talk about questions later. Thank you.